Hi, my name is Brianna, and this is my Nursing 335 clinical reflection presentation. First, I'm going to start with Objective 1, which is utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I feel like I met this objective while doing my peer leadership hours. I worked with students on their first prep at Lehigh Valley Muhlenberg. I did a 309 therapeutic communication where we were in a nursing home setting, and then it was a half day, so we ended up coming back to the lab, and I was able to teach them how to do bed baths, perineal care, shaving, all of that. I also participated in a vital signs practice for 311, and I also did a peer leadership for Nursing 341 with Professor Axe, which I thought was a unique opportunity because it gave me a little bit of insight into what next semester is going to look like for me. But my favorite one, I think, was the first prep, because I felt like I was able to actually utilize things I've learned in the past year to really help those students, overcome the anxiety that comes with their first prep and help them navigate EPIC, which I know I had difficulty with my first prep. Help them find out, pick what's important, what's not really too important that they need to stress out about putting down on their first paper, what meds to prioritize. And I also was able to help them prioritize their nursing diagnoses and even help form them. I was able to point out in the nursing diagnoses book, and it was a really nice experience, and I felt that I really was able to give something back for what I learned this for over a year. So then Objective 2 is apply basic principles of management to meet the challenge of an ever-changing healthcare environment. And I felt like I met this objective with my advanced practice. I followed Marshall Bowen. He is the emergency department manager for St. Luke's, the Miners campus, which is right near my hometown. So I went and I was able to shadow him for the day, and he was a very effective leader. The staff spoke very highly of him. He really was able to transform any scenario into something you could understand. He gave you examples. He really made sure everybody left there knowing what they were doing, knowing what he was talking about. And he also started his whole career in the emergency department. He was an ED tech, and then he was an ED floor nurse, and he gradually moved up in the chain of command in the emergency department, which I thought was interesting because he was able to apply all those years of experience to his management style now, and he really reflected on those experiences and said how he felt like they made him a better manager and better suited for that position. And then he also allowed me to shadow a few nurses on the floor during the day, only for select cases, but I was able to actually follow the clinical coordinator and see her management skills with scheduling, with making sure everything's taken care of, her doing her rounds, everything like that. So then Objective 3 is demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. So I felt like I met this objective by doing my volunteer hours with Tammy Bean. I went to Daybreak Transitional Facility. It is it's like the after an inpatient mental health stay. It's a center for people with mental health issues, people who are living with HIV or AIDS, or recovering addicts, to go and spend their day in groups, learning teamwork. A lot of them were volunteers themselves. And I felt like while I was there, I was able to run into a few students from other colleges like El Tri-C, DeSales, Muhlenberg, and they were all there also for their ethical hours or their mental health hours, clinical hours. So I felt like I represented myself in the college well when I was interacting with them, and we were discussing the differences between our programs and their programs, and we worked together a lot on We did some crafts together with the people of Daybreak. We served lunch together and breakfast. They received 3 hot meals a day, and we were able to help prepare and serve. And we just really communicated well and worked very well together as students. And I also felt like I was able to communicate with the members at Daybreak very well. It was a lot of therapeutic communication, which I was able to relate back to my own mental health clinical. And it was nice because you have so many different people throughout the community that you get a lot of different perspectives on life and situations, and it gives you a little bit of insight that everybody's going through something differently, and not to judge a book by its cover, and that, you know, So, objective number 4, critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. So for this, I have 2 articles prepared for post-conference that I will go on and discuss then to meet objective 4. Objective 5 is function as a competent patient advocate, nurse advocate, and change agent. And I felt like I was able to achieve this objective through my interprofessional hours at Luther Crest. Luther Crest is a long-term nursing facility, and I was able to sit in on quite a few meetings with who I was with that day. The first meeting involved nursing management, therapy, physical therapy, occupational therapy, dietary, even housekeeping, maintenance staff. It involved everybody. It was interprofessional, to say the least, and we were able to represent nurses there and be advocates for the nurses on the floor and what they needed from the other staff members or what they needed from the other professionals. And it was nice to see everybody kind of working together to make sure everybody was advocated for, most importantly the patients, but also the nurses and the rest of the healthcare staff. Objective number 6 is formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and a contributing member of society. So I felt like I achieved this objective through the SNA Dine and Discuss. I attended all of them, and the last one is going to be tomorrow. And the 2 that stood out to me was, the first one was a pediatric oncology nurse, and she really stressed the importance of, she was an adult learner when she came here to Cedar Crest, she's an alum, about furthering your education and, no matter kind of what life situation you're in, that, you can do it. And it was really nice to see, because in actually my 330 clinical, my pediatric clinical, I was able to go see her working at the cancer center. So it was nice to make that connection between, her speaking about her growth and development and actually seeing it through. I also really enjoyed the nurse anesthetist that joined us, and he spoke to us. He also is a Cedar Crest alum, and he was very blunt, but very informative about what that profession entails and the dedication needed, which also was nice because we then did have the head of the nurse anesthesia program here come in and discuss it. It was nice to make that connection of, varying programs of what he's saying, what she's saying, and really put them together just to see if it's the right fit, if I would like to continue my education to move on to that or not. But overall, I feel like in those Dine and Discusses, they really push for furthering your education and growing as a nurse over time. Objective 7 is recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. And this objective was met by Capitol Hill Day. We went to Capitol Hill and we were able to track down our state legislators and see what current bills they were working on related to nursing. The biggest takeaway from Capitol Hill Day, though, was the PSNA leader who came in and talked to us. Before this clinical, I had no idea that the Pennsylvania State Nurses Association was a thing or even something to be a part of, and her coming in and explaining their role and how it benefits nurses was interesting to hear, and it was kind of eye-opening. I had no idea that really nurses were so involved in politics and that they were so involved in policy making in hospitals. And it was nice to see that somebody is involved in this lawmaking that would help protect nurses and help them advance their careers as much as possible. It was just very comforting to see. I also briefly discussed this with my advanced practice, Marshall Bowen. We were going through the objectives on my verification form, and he was interested in what other experiences we were able to do, and I specifically mentioned Capitol Hill Day, and he brought up a few good points about how important it is to advocate, go out, register to vote, and things like that, exactly like the PSNA speaker told us. He said, in a profession that is mainly dominated by women, he sees a lack of advocacy because of gender, because women are, he felt, less likely to actually take off work to go vote or to go petition or rally or anything like that. And he was a very strong advocate for women in nursing as well as the men, but he made that a very big point for me to remember and understand, and he really, really urged me to go out and vote and get as much involved in the political point of nursing as I could. And lastly, clinical objective number 8 is predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. And both of these, once again, I saw with my advanced practice, but this was with the clinical coordinator who I was able to follow for a little while. And I would relate this back to the ANA Code of Ethics, both Provision 3 and Provision 7. Provision 3 states that the nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. The clinical coordinator was doing her rounds, and she noticed that a young new nurse left her computer open in the hallway, and she was very polite and private about it. She made sure to pull her aside, say, this is a HIPAA violation, like, just be cautious, minimize your computer. I understand that, accidents happen, but it's something we can't have happen here. And she was really striving to protect the health and safety of the patients in the emergency department, at the same time of being really very respectful of the new nurse and not making her feel inadequate or that she did something wrong. She understood and made her feel she wasn't demeaning about her discipline. And then Provision 7, the nurse participates in the advancement of the profession through contributions to practice, education, administration, and knowledge development. And with the clinical coordinator, I was able to actually talk to her about the new St. Luke's Geisinger campus, as well as Marshall. We were all kind of discussing it. And they were actually training nurses for this new campus in the Miners campus emergency department. So she was helping, contributing to their education while that new site is still getting up and running. She was using her administration duties as well to help schedule them, to help figure out how many more hours they needed to do at Miners and when they were able to advance to the new Origsburg campus. And she was just very knowledgeable about their transition. She was very helpful. She wanted to make sure they had the best experience in the Miners campus as possible. Overall, I think it goes to speak for itself that the advanced practice was my favorite of the clinical experiences. I actually hope to apply to the position of the emergency department fellowship for the new nurse graduates, and Marshall Bowen is one of the members who actually interviews for this position. So it was nice to get that insight. I got to ask him a few questions about the position, and he gave me some tips and tricks and things to, make sure I'm ready and prepared for the interview if I still choose to do that. And it was a good experience, and overall I felt like this leadership clinical showed me a lot of things, a lot of outlets of nursing that I didn't even know existed before this. And I felt like it really helped me grow as a student and will help me further my career in the future and to know all my options as a nurse. Thank you for watching.